Hello Medicos. In this video I'm going to explain arterial thrombus, mural thrombus, vegetations, all these things to you. So first of all we will understand the arterial thrombus. So here the story begins. There is some atherosclerotic plaque in your artery. This atherosclerotic plaque when this will be ulcered, there will be an endothelial injury. So here whenever there is an endothelial injury, there is exposure of von Willebrand factor that is present in the subendothelial region, and the platelets present in circulation will recognize that von Willebrand factor and will rush towards that site and will bind to the von Willebrand factor. This is how the platelet plug formation starts at ulcerated atherosclerotic plaque. So arterial thrombus has one characteristic, that it is usually superimposed on this ulcerated atherosclerotic plaque. The second thing is it consists of platelets, fibrin, RBCs and WBCs. We know typical thrombus consists of usually platelets and fibrin. This is a property of blood clot. Blood clot is formed from aggregation of platelets and fibrin. And because the blood flow is high in our arteries, so there are some RBCs and WBCs that becomes entrapped also. So arterial thrombus consists of four things, that is platelets, fibrin, RBCs and WBCs, and it is usually superimposed on ulcerated atherosclerotic plaque. And now the third property came here, that it grows retrograde to the flow. Now we have to understand this concept. It grows retrograde means that blood flow in our arteries is away from the heart. So but the thrombus will form towards the heart, will form retrograde to the flow. Why? Because we know whenever blood is flowing, here there will be accumulation of more, there is turbulence and there is accumulation of more and more, like blood is flowing like this. So can you see, it is growing retrograde to the flow. So arterial thrombus grow retrograde to the flow means they grow towards the heart, and they're usually occlusive. They are mostly formed in coronary, femoral and in your cerebral vessels. This was all about the arterial thrombus. Now let's move towards the mural thrombi. The thrombus formation on our heart chambers, in our heart chambers, is called as mural thrombi. The thrombi that are found in our heart chambers and in aorta, that are called as mural thrombi, they usually, there is thrombus formation stimulation. Why? Because whenever there is some endomyocardial injury, like our myocardium is injured and that some endothelial region become exposed now, and that will led to the accumulation, adhesion, aggregation of platelets, and that's how thrombus formation is favored whenever there is endomyocardial injury. Second thing is myocardial infarction. In myocardial infarction, again we know that there is some compromised portion of the heart in which there is no blood supply, and that portion of heart undergoes necrosis, and that necrosed part is no more contracting. So whenever there is no more contraction in some part of the heart, there is usually stasis of blood, and stasis of blood will promote thrombus formation. Third thing comes here, that dilated cardiomyopathy. Again, the name depicts that dilated. The word dilated. Dilated means there is some dilation in the heart chambers, and that will lead to the stasis of the blood, and again there will be the mural thrombi. So these three reasons are due to stasis, and this is due to myocardial injury. Now, aneurysmal dilation, again we know whenever our aorta or some arteries are dilated in their some portion, this is called as aneurysm, and in the dilated portion there is again stasis of the blood, and there will be the thrombus formation. Now another thing, there is atherosclerotic plaque. Atherosclerotic plaque will become ulcerated at some point, and that ulcerated atherosclerotic plaque will injure our endothelium, and then again the injured endothelium will lead to the thrombus formation. So here the reason is endothelial injury, while all these factors promote thrombus formation through stasis. Now let's move to the third term, that is vegetation. Now the thrombus formation on our heart walls is called as vegetation. Again we have to discuss the reason why the thrombi are formed on our heart walls. First one is endothelial injury. I have explained 100 times that how endothelial injury will lead to the thrombus formation. Second thing is blood-borne infection, like some fungal or bacterial infection. They will affect our heart walls and they will rupture our endothelium there, and again there will be the endothelial injury which will lead to the thrombus formation. Third thing comes here is blood flow imbalance. We know whenever there is blood flow imbalance, our normal blood flow is in laminar situation, and whenever there is some turbulence or there is some stasis, there is blood flow imbalance. There is the contact of platelets with our endothelium as well as endothelial activation that will lead to the blood flow imbalance, and blood flow imbalance in this way causes the thrombus formation. Fourth thing is hypercoagulable state. Hypercoagulable state is any disorder, any alteration in coagulation pathway, or any disorder of the blood that will lead to the thrombus formation, and I have explained this hypercoagulability in my previous video in detail. So these were all about the arterial thrombus, mural thrombi, and vegetation. Now, how these thrombus look like? So there is a characteristic of these thrombus that there are lines of Zahn. What are lines of Zahn? Lines of Zahn are gross or microscopic lamination. They are basically the alternating layers of dark and pale portion. The dark portion depicts the accumulation of RBCs, and the pale portion depicts the portion of platelets and fibrin. So lines of Zahn are the characteristics of thrombi. And lines of Zahn have some importance in diagnosis of whether the clot has formed antemortem or postmortem. Antemortem clot has usually lines of Zahn because it is formed in flowing blood. So there is accumulation of RBCs at some portion. That's why that brown portion is present in there, and that is the line of Zahn. But if the clot has formed in postmortem state, so one thing can be there will be no attachment of this clot with the underlying, because the reason here is not any endothelial injury or anything else. So the clot will not adhere to the underlying surface, one characteristic of postmortem clot. Second, it will not show any lines of Zahn because it is not formed in flowing blood vessel. It will rather show it will show two things. It will show a pale portion that is present on upward, and it will show red portion that shows the RBCs accumulation in the dependent portion, like that follows the gravity. So these are the features of postmortem clots. They are not adhere to our underlying endothelium, and second, they don't show any lines of Zahn, while the antemortem clot shows a line of Zahn. In this video, we are going to study venous thrombi, means thrombus formation in our veins. There can be two ways for the formation of thrombus in our veins. One way is thrombophlebitis, and other one is flat thrombosis. Thrombophlebitis means first there will be inflammation in our veins due to some reason, and then there will be the thrombus formation due to endothelial injury. While the flat thrombosis means that there will be no inflammation, only there is thrombus formation. So whenever there is inflammation, there can be some reasons. There can be some sterile reasons as well as there can be non-sterile reasons. Sterile reasons can be such as trauma, radiations, chemicals, anything to our vein vessel wall that will lead to the inflammation, and then inflammation will rupture our endothelium, and that will lead to the venous thrombosis. And the inflammation can also be due to some non-sterile condition, like there are exposure of some infections that are injuring our endothelium. So there is inflammation, and that will lead to the venous thrombi. Well, flat thrombosis is unassociated with inflammation. So venous thrombi can be formed in two types of veins. It can be formed in superficial vein as well as deep veins. Superficial veins like saphenous veins, deep veins like femoral, iliac, popliteal veins. What happens when venous thrombi forms in superficial vein? There can be the congestion, swelling, and pain. There is blood accumulation, so there is congestion, there is swelling, there is tenderness, and there is pain. While in deep vein thrombosis, there is no pain, no edema, no congestion. Why? Because in deep vein thrombosis, there are some collateral channels opening that will prevent edema and pain. And these deep vein thrombus have the risk to embolize to the lungs, and in the lungs they will lead to the pulmonary infarction depending upon their size. Why deep vein thrombosis occurs? There can be some immobilization. Whenever there is immobilization, there is stasis of blood, and that's how thrombus formation favors. Hypercoagulable state, I have explained this in my previous video, how hypercoagulable state will lead to the thrombus formation. Now, trauma, burns, and surgery. We know in trauma and burns there is endothelial injury. In surgery as well there is endothelial injury. After surgery, we have to advise our patient to get some bed rest. So there is immobilization. This is how trauma, burns, and surgery causes deep vein thrombosis. Now, cancer. Cancer, we know that tumor itself releases some procoagulant factors that will lead to the deep vein thrombosis, and this deep vein thrombosis, which is due to cancer, which is due to trauma, which is due to tumor, is known as Trousseau syndrome. It is known as Trousseau. This was all about venous thrombosis. Thank you for watching. Bye bye.